name is Ailish and I'm a chartered physiotherapist with TheBumpRoom, and you're watching a video blog, the title of which is Overactive Bladder, Learn More. Okay, so I also experience this actually when I'm not pregnant as well. Okay, so that's kind of important because we hope that some of this advice is really for the postnatal women. A certain amount of urgency during pregnancy is normal because of the hormonal changes. So just in terms of urgency, the signs of it are that you have this overwhelming urge to go to the toilet and you get it quite frequently and you have difficulty controlling it. And sometimes people would also describe it as kind of the key in the front door syndrome, as in the minute you get to the front door of your house, you're bursting to go, you have to go to the toilet and you have a lot of difficulty controlling it. Also, you might be someone that's a toilet mapper, okay, so anywhere you go, you'll immediately have mapped where the toilets are, okay, so that's someone that usually has a bit of urge incontinence in the sense that they can't hold it or they can't control it for as long as maybe people who don't have it. Now, if you have a little bit of leakage with this, then it's called urge urinary incontinence. Okay, so if you have a little bit of leakage, that's what it's called, urge urinary incontinence. And essentially, this is a bladder problem. Okay, so basically your bladder is overactive, and the muscle that's responsible for this overactivity is called the detrusor muscle. Now, you can help dampen down the effect of the detrusor muscle by doing your pelvic floor exercises. Okay, so that's one of the roles of the pelvic floor exercises. So do your pelvic floor exercises as normal. That's one way of managing it. And then the next way of managing it really is looking at your bladder habits, okay, and figuring out how normal or not normal they are. Okay, so knowing normal bladder habits is very important in this situation. So normal bladder function, so we should be drinking 1.5 to 2 litres of fluids a day. It's normal to go to the toilet 4 to 7 times a day and once at night. Okay, so that's normal activity. And then the capacity of our bladder is between 400 and 600 mils. So when you do go to the toilet, you should possibly have around that volume. Okay, so that's what's normal. So for me, I know if I'm bad, okay, if I'm not doing what I should be doing with my bladder, if I'm not keeping my bladder in check with good bladder habits, I can go up to 10, 11 times a day. Okay, so that's not normal. So straight away I know I'm going way more frequently than I should. And also I know when I do go, I'm not going like 400 mils. It's not that much. Okay, so again, I've just let my bladder slip into bad habits. So if I want to like train my bladder again and kind of bring my bladder back into shape, there's a few things I'll do. First of all, I will reduce my caffeine. Okay, I might cut it out altogether just for a week or two, just to give me a good kickstart. You will notice a massive difference if you can cut out your caffeine. Okay, so your teas and your coffees. I normally would say just go cold turkey, cut it out altogether at the beginning. Okay, so because caffeine is a real stimulant for the bladder, it kind of stimulates that muscle and we just don't need any more stimulation, so we take away the caffeine. The next thing I would do is I'd probably do a quick bladder chart, just for one day even, and I just count how many times did I go, how much fluids did I drink, so just put everything in a jug really before you drink it, how many fluids did I drink, what type of fluids did I drink, and then how much did I pee out. Okay, so that's the hard part, you kind of have to have this jug in the toilet for the day, alright, but it's worth doing it because once you do your bladder chart and you actually see, oh, I went 12 times today and I'm only peeing out 150 or 200 mils, then you know that you're not reaching your capacity in your bladder and you need to train your bladder up again. So in order to do that, then you have to introduce a pee schedule. Okay, so with the pee schedule, you don't want to say, oh, that's it, I'm going to go 8 times, okay, because you have to just do it really slowly. Okay, so if you know you're going 11, 12 times a day, okay, you're just going to cut back one of them to start off with. Okay, so what we say to people is look at the urge messages that you get, like text messages. Okay, you can ignore the first text message you get from someone. Okay, you can ignore the second. Okay, but you can't ignore the third. All right, so ignore the first urge, ignore the second urge, but on the third one, go. Okay, so if you can just try and hold back the time a little bit over the whole course of the day, you probably drop how frequently you're going and you'll start training your bladder to hold more. Another trick as well is when you do get the urge, just go up and down on your toes, okay, because that's the same nerve that supplies your bladder, supplies your calf muscle, alright, so that's why kids do this. You know, when they're going to the toilet, they do this pee-pee dance. The reason is because they naturally know that if they go up and down on their toes, that they're going to be able to hold off that bladder contraction. Okay, so that's just a little trick that you can do, okay, if you're in a bad situation. So that's what I'd say. They're the main things. Reduce your caffeine, do a bladder chart, introduce the P schedule. You can do little heel raises, and hopefully that will help. If it doesn't help, you might need to go to your GP, go to your doctor, go to your physiotherapist. Okay, there are medications available that can help with this, and sometimes people need it just to kickstart. So that's it. Thank you for watching this video blog. Please keep watching. If you'd like to get more regular video blogs, just log on to the website, TheBumpRoom.ie, and please share. Okay, so thank you.